Hello, dear friends. It's Dr. Sarah. If you're watching this in current time, I wish you a very happy holiday season. The time leading up to the holidays can be hectic, stressful, and packed with additional commitments. The extra hustle, bustle, and additional commitments can sometimes lead to overwhelm and decrease our excitement of fully immersing in the festivities. Besides the common triggers, diet culture messages can dig their nasty claws into our mind and rob us of our joy. Food morals and rules can not only keep us from fully enjoying treats, but can also contribute to our seasonal stress and hamper our digestion of them. This is why I started a series of tips to aid you in relaxing easier so you can enjoy these precious times. Since most of us will be partaking in holiday treats, I wanted to start with information on how to help you feel more nourished and comfortable. In my first video, I highlighted the bidirectional relationship between stress and the gut. I also gave you a few simple tools to mitigate it. Finally, I revealed the best essential oil to help you relieve the holiday bloat and upset belly, which may occur from consuming seasonal yummy goodies. In this video, I'll expand on the topic of supporting a stressed out gut using naturopathic and functional medicine. Topics that we'll go over are a summary of the gut stress axis and the power of our favorite holiday oil, peppermint oil, not just for its scent, but what it does for our bellies, a review of some of the important basic and functional lab work to consider ordering if you have chronic digestive issues, several naturopathic and functional medicine interventions to soothe digestive distress. These include things such as digestive enzymes and supportive nutrients, lifestyle, and foods that support microbiome health. And finally, I want to talk a little bit about balance. In the final tip of the series, I'm going to provide an overview of some of my favorite digestive herbs and essential oils. So that will kind of have its own category in this video series. As always, all the links to the references, the resources, and past clinical tips will be in the video transcript. So let's go ahead and get started. Before we go into this week's topic, let's review what we learned in the previous video and get everybody up to date. So first, we reviewed how the relationship between stress and the digestive tract is a two-way street. This means stress can cause havoc on digestion and absorption and gut immune response, and it can also lead to a leaky gut. On the other hand, an upset belly can be stressful on the mind and impact emotions and mental health. Along with probiotics, a diverse diet, and mind-body techniques, essential oils can ease digestion and calm the nerves. Last time we talked about the most famous essential oil for soothing an irritable belly, peppermint oil. There is a lot of research on how it is effective for irritable bowel syndrome. This oil is actually my go-to recommendation for holiday bloat and tummy troubles. But before we get into more solutions, now that we kind of have an overview of the gut stress link, it's important to assess what may be contributing to gut problems and malabsorptions. Because even if I give you some tips to mitigate it, if it's not addressing the root cause, then you won't see the results. So one of the things besides symptoms we want to look at, especially if it's a chronic issue, are labs. So I want to break these down into little categories of basic labs. There's also imaging, and then look at some functional labs. So the following are some basic labs that a primary care provider can and often does order when someone has digestive disorders. The first is the basic complete blood chemistry. What's here to key in on is things that helped us determine overall metabolism, kidney and liver health, electrolyte, and blood glucose. So all of these can contribute to an unhealthy gut, and they can also be altered to GI dysfunction. So looking for things like blood sugar, electrolyte imbalances can be keys that something's going on with the gut. A white blood cell differential. This evaluates immune deregulation and activation as chronic infections can impact gut health. So you're going to look at the numbers of white blood cells, your little immune cells in your blood. And then hemoglobin A1C. This test helps determine if there's a blood sugar imbalance over a longer period of time than just glucose. gut health, the microbiome, and intestinal permeability can all alter glucose metabolism and vice versa. Again, okay, so we have blood sugar also impacting gut health. Now, other tests that may not be as common, but something to consider if someone has chronic digestive issues are a comprehensive thyroid panel, because you want to rule out hypothyroidism as a secondary cause of constipation to slow digestion. That can often be an underlying trigger many don't look at. An iron panel, if someone might potentially, there might be sign of anemia or some bleeding problems or ulcers, and then other immune and inflammatory markers, depending on exactly what the doctor might feel is appropriate for if someone is chronically inflamed and they're having digestive issues. There's also proper imaging and testing for lower colon abnormalities, ulcers, gastrointestinal reflux disease, and those should be performed as needed. I have a list of all of those different tests if you're interested in the link in the video description. If we look at more functional labs for dysbiosis markers, now dysbiosis is microbiome imbalances, or those little gut bugs that are in our gut can become maybe more pathogenic and less balanced, or what we call commensal or natural organisms that are in the gut that help support our health. These are usually run by naturopathic and functional medicine practitioners or an integrative doctor. They include things such as comprehensive stool tests. There's different companies, but most of them offer a complete look at the gut, especially its function, because they'll measure things like if there's pathogens, but they'll also look for digestive markers, nutrient absorption markers, inflammatory markers, and immune function at the level of the gut. This includes celiac markers. And then if you want to test for SIBO, which is small intestinal bacterial overgrowth, which is in the upper portion of the gastrointestinal tract, things such as they might test for H.pylori or other pathogens. And these results actually help determine if there's an infectious cause behind, say, GERD or ulcers or other digestive disorders. So once we can determine what the cause of the digestive dysfunction is, say we ruled out any infectious issues and any bleeding issues or any pathologies and resulting imbalances, we can now start to incorporate some lifestyle shifts and natural interventions, especially if we suspect that stress is one of the major players. So here are some common naturopathic and functional modalities and suggestions you'll often come across if you go to a naturopathic and functional medicine doctor with chronic stress and digestive issues. And this holds true not just for holiday tummies, but for tummies throughout the whole year that can be in distress. So one of the first things, and one of my favorite modalities or interventions, are digestive enzyme support, because these help you replete nutrient absorption. When your body is stressed, it does not absorb nutrients as well because you're in fight or flight rather than in rest and digest. So I always have, or most often have, my clients that are under stress take a digestive enzyme with their meals. It'll just help them absorb the food, prevent some gas backup later on. If you supplement with digestive enzymes and hydrochloric acid as indicated for the stomach, which helps digest the protein, it also helps with assimilation of iron, zinc, and B vitamins, which are critical, interesting for various other physiological functions, but also for actually producing stomach acid. So you have this feed forward cycle. If you can't produce the stomach acid because you're stressed, you're not getting the nutrients absorbed that you need to produce it in the first place. So these supplements can aid with alleviating some digestive complaints. They can serve as a tool to help you as your body heals and you get the nutrition that you need, and hopefully address some of the root causes of some of the stress. Things such as heartburn, constipation, slow bowel transit time. Digestive enzymes are something to consider. If we're looking at nourishing foods and lifestyle choices, we want to consider that these can help the microbiome, and we think about the gut brain link, right? And the gut stress link. So different things that can improve digestive health via the gut brain connection are not too hard to decipher, but things such as fermented foods like yogurt, kefir, and sauerkraut, those actually help bring in some probiotics to the gut and give the gut bugs something to eat and enjoy. They're polyphenol-rich foods from plants and beverages. Think of cocoa this time of year, hot hot chocolate with actual cocoa powder, dark chocolate with polyphenols, green tea, and coffee. Those are some of the most common actual polyphenols in the American diet, and they're actually good for our gut bugs. Fiber is good for most people. I'll get to a little caveat on that later. Lifestyle changes. So this is where stress reduction comes in, making sure you're getting proper sleep. If you are tired, everything is stressful because your body's just trying to function and stay awake. So that's one of the key hacks, and the simplest and least expensive is try to get to bed a little bit earlier and sleep. You can also use movement. And a lot of times if people are chronically stressed, this might mean things like restorative yoga, right? We don't want to keep increasing cortisol or the stress hormone, but it could also mean a walk. It could also mean if someone needs to burn off excess cortisol, getting into HIIT training. So just what's right for you. But movement also helps support bowel health. It shifts the microbiome. It can help with transit time if someone's constipation. But it's still important to be aware that everyone has different needs, and some healthy foods can be suboptimal for others. So in general, say we think fiber is good for gut health and it helps with constipation, but too much fiber can actually aggravate some gut conditions because it could actually be feeding the pathogens. So if you don't have the prowess to effectively digest and absorb what the actual ingredient or food is, it won't be helpful. And again, this is where personalization comes in to play. Another example I can think of is if you have histamine reaction or mast cell activation, or you've been in mold and you're very sensitive to excess histamine, fermented foods, aged cheeses, those will not be your first choice to go to. It can cause a lot of discomfort and create excess histamine responses in people that have a hard time breaking down histamine. Okay, so I don't want to stress you out more about what foods you can and can't eat. That's not the point. The point is that we can use things like digestive enzymes, movement, stress reduction techniques. We talked about peppermint oil to help us with our gut. And the goal in my practice has always been about practicing balance in diet. And I encourage people in my practice to eat and nourish their body, to enjoy their food by adding foods that they know will benefit them, that they enjoy. I do not like to focus on restriction. This can lead to disordered eating, orthorexia, and it trumps any positive benefit because your body's in constant stress. And that just leads to disordered eating, and eating disorders are the number one mental health disorder that is actually fatal. So that's not cool. So we don't want to do that, and we don't want to take away all of the benefits we could get from our holiday gatherings by focusing and worrying about if we're eating perfectly. If we aim for balance, I feel that the benefits of feeling great and being properly nourished will allow people to enjoy pleasure and to actually partake in different treats without feeling guilt or suffering digestive repercussions. And I have seen this time and time again in my practice. I've not had to use restrictive diets for my clients in years because of this philosophy that I've had. You can find the links more on diet culture in the video description. So let's summarize up these naturopathic and functional medicine support modalities for digestive health and holiday tummy distress. First of all, let's remember that stress can alter gut function and impact our digestive health and overall wellness, and digestive distress perpetuates stress symptoms. So we have this vicious cycle. There are various naturopathic and functional medicine interventions that can support a stressed out gut and calm it down. Once the causative factor is found using appropriate lab work and symptoms, natural modalities can be used to help alleviate digestive woes. These include things like digestive enzymes, nutrients, and foods that support microbiome health, your microbiome health. Finally, remember to practice balance. Practicing balance with eating is much better for mental health than basing your decisions on food rules and external cues from diet culture. Food decisions are not a moral issue, and using your dietary practices to validate your self-worth is very dangerous to your physical and emotional health. What you nourish yourself with should be viewed as a tool to help you feel vibrant, less stressed, and help you fuel your best life. So With all that being said, the final video before the holidays, we'll discuss more about herbs and essential oils for digestive health. So we'll get into kind of really deep plant medicine here for digestive. I hope that this information can help you feel more at ease, to comfort your belly and brain, and help you relax and know that if, for the most part, you're eating in a way that nourishes yourself, it's okay to enjoy in the community of partaking in certain foods that is your family tradition this time of year. If you can't get to the bottom of chronic digestive issues, though, these are basic things that can help most people. You might want to check with a naturopathic and or functional medicine doctor to give you additional support. They can assist you in finding and remediating the contributors to a stressed out gut that might be harder to dig through and still give you some personalized support for your mind-body health. So many blessings for a beautiful holiday season ahead, and I will see you real soon.